what's going on, Facebook? I don't know what's going on with my intro right now. So we're just going to skip that one for right now. What's going on? Hello. Thank you for joining yet another episode of Ciphered Knowledge with Chrissy. Listen, we got a great show for you tonight, but before we start and introduce the guest for this evening, I wanted to remind you to make sure you go over to Instagram and Facebook and like and follow at Chrissy.Cipher so that you can get all the up-to-date content, all the promos, what's going on, what's new, little clips here and there, some inside stuff. So make sure you do that. Also, make sure you head over to 2M1L Media on YouTube. This is where you're going to get a bunch of different content, all different shows. You're going to get Cipher Knowledge with Chrissy every Sunday at 8 p.m. Eastern Standard Time. Saturdays and Sundays, you get Around the Turnbuckle at 6 p.m. Eastern Standard Time. On Wednesdays, you get Spittin' with Spitter at 8 p.m. Eastern Standard Time. And on Tuesdays, you get Home Team Sports and Entertainment at 6 p.m. Eastern Standard Time on Tuesdays. So with all of that out of the way, I will go ahead and hit our first. Hi, Alan. Thank you for joining us this evening. I hope you're watching. You got a little girl, so these are some things you're going to need to know about, all right? So make sure you stay watching. But I would like to go ahead and introduce my guest of the evening, Dr. Jully Aguirre. So thank you so much for being on the show. Thank you for taking the time and the opportunity to come on and share this information with me. So why don't you go ahead and tell us a little bit about yourself? What is your specialty?
Well, first of all, thank you for having me on your wonderful show. Very proud of you and happy to be here. I am an OBGYN, which is obstetrician, gynecologist, for those of you that don't know what an OBGYN stands for. And what that means is that I am pretty much a women's health specialist, focusing both on obstetrics, which is delivering babies and taking care of women in pregnancy and their babies in the womb, and also gynecology, which is comprehensive women's health from sexuality, preconception, planning, and also different things that can happen downstairs that women don't want to talk about, but often need to talk about. And I try to focus a lot on education and preventative health, so preventing cervical cancer, breast cancer, and things like diabetes and heart disease. For the most part of my job, I spend it doing annuals, which is comprehensive women's care. And preventing heart disease and diabetes are part of that, even though it doesn't have anything to do with the downstairs.
Yes, and that heart disease is very high amongst women, and that's something we can definitely dive into. So my first question is a question that I ask everybody that comes on the show, and that is, what inspired you to become a doctor?
So I think it was a long process for me. When I was a child, apparently I had a lot of desires to dissect things. And so all of my dolls had, wounds that needed mending. I would take the head off Barbie and put it on something else and try to make something new. My sister really loved that because they were usually her Barbies. And then obviously everything health related was very gross. I was very good at anatomy and physiology. And what that meant at that time was that I could take a cat, memorize all of its muscles, all of its tendons, and that was pretty much my favorite class in high school. Yet I wanted to be a performer, and I wanted to be a musician, and I wanted to either be on Broadway or singing somewhere, and or I wanted to take care of people with music, which was music therapy, and that's what I ended up picking as a major. Once I got there, I realized very quickly that I did not want to perform, and I don't do well in front of the camera. Which is
you're doing, I don't know what you're talking about. You're doing phenomenal, but go ahead.
And no, I literally would freeze on stage. It was pretty terrifying. So one of my mentors for my major said, you know what, you keep asking all these why questions. why do people have Down syndrome? Why do people have, mental issues that leads them to need music therapy? And she said, maybe you should try out a biology course. So very early in my freshman year of college, I went into biology, very quickly realized that I was good at that and that I really liked it, and it answered a lot of my questions.
Mm-hmm.
And now reflecting back, I see that this was probably my calling from the get-go. My mom had a preterm baby. That was my sister. And she was born at home. And before that, she'd had a brother of mine who was born at home and died. And so, you know, knowing a lot of the complications that led to those things, and knowing kind of some of my family's history, it really does inspire me to continue doing what I do and fuels the fire that, helps me love every aspect of what I do.
That's amazing. And thank you so much for sharing that with us. What people don't know that's watching is Dr. Aguirre is my sister-in-law. So I didn't know that. I didn't know that. We're family, and I didn't know that. So thank you so much for sharing that with me. I really do appreciate that. That is the most in-depth answer that I've ever gotten when I've asked somebody what inspired you. So I really do appreciate that. And I mean that sincerely and genuinely. So getting into a little bit of, because I kind of broke down the questions. We want to do GYN, OB, and kind of women's health and just, get a little bit of everything. So at what age should a young woman start seeing a GYN?
So that's a really interesting question. And the answer is really it's dependent on what your needs are. Everybody has different needs. There are pediatric patients who need to see a gynecologist. Some little girls get very curious early on and want to put things in places that they don't need to put them. And that's a good time to go see a gynecologist if there's ever any suspected trauma, or if there's, even, blunt trauma, little girls falling off of trees and hitting a stump, or falling off a bicycle and hitting the seat hard, might require a pediatric visit to the gynecologist. The other things are things of sexuality. Some parents get really upset when they discover that little Sally is touching herself too much in the shower or whatnot. And in that sense, it can be a little bit more of an education time for the whole family to understand that that's completely normal in a small child, and doesn't necessarily always indicate abuse or problems. And then there's the routine age where we start doing pap smears, which has changed. The recommendations used to be anytime somebody became sexually active, they needed to start getting their pap smears. Now that's changed. As of 2012, they changed that recommendation to women at 21. Unless you were sexually active, starting at the age of 10 or 11, which you may have had if there's a history of abuse or whatnot. But for the general population, 21 years old, or if you're having menstrual problems or issues with your period or sexuality, etc., then it might be a good time to seek care before that.
Perfect. I remember taking my daughter at 16, and that was because I suspected, some activity. I was wrong. Thankfully, I was wrong. But I think that was a hard question for me because I didn't know. It's like, do I go now? Do I not go? Even if it's just, I don't know that they did a pap smear at that first visit, because they did ask me to leave the room. So I had to go because she was 16. And I believe you can tell me, I don't know if it's state by state, or if it's just kind of a general, I think here in New Jersey, it's 14. They can be seen without the parent in the room.
Yeah, I think I know here in South Carolina, it's similar to at 14, they should have access to birth control and other healthcare, reproductive technology that, they can get without the consent of a parent. And I do typically ask parents to leave the room, whether or not there's sexual activity or not. There's usually some sort of conversation about healthcare risks at that age, and not just when it comes to sex, but when it comes to drugs and alcohol. And so I think most gynecologists have a little bit of a spiel that they go through, and they kind of mention, okay, whether or not you are doing this, these are good things to know. And honestly, I am an open book when it comes to that. You should talk about all of the things that can happen at the age of exploration, including, some of the risks of anal sex or oral sex, and, the things that are out there that maybe you haven't heard in your sex ed class in school. And so I think it's always a good time if there's any suspicion of sexual activity, or even if there's not, if as soon as periods begin, and, typically teenagers have a lot of questions. Now I can tell you, they're not going to ask me either.
No, really? You don't think
No,
so?
they get really, really shy. They get so shy. And so you just have to kind of bring it up, and then they get all blushy, and you're like, you're going to have to hear this at some point in time, because if you don't hear it from me, you're probably going to hear it from friends. You're probably going to hear it on the internet.
And you should hear it from the professional versus somewhere else. We have a comment. So Alan says, my daughters are 8 and 3. I'm good for a while, right? Also, thank you, doctor, for coming on and sharing all of this very useful information to all the ladies watching, as well as parents like myself. So, thank you, Alan.
Yeah.
Okay.
So a lot of girls do start having their periods at 8, 9 even. And so, sometimes they may be forthcoming with that, and sometimes they may not. But you usually see some kind of early development changes, breast changes, height changes, pubes, and that kind of stuff that can start happening before the first period. But it's never too early to start talking to your kids, particularly girls, about sexuality, when it's okay to say no, which is always. What is correct touching, what is incorrect and inappropriate touching, and what to expect at these health visits. I feel that many girls are so terrified when they come into my office. They're literally trembling, like so scared that I'm going to do God knows what to them. And there probably are some families or some girls that have had bad experiences, with doctors and gynecologic exams. And so kind of getting that set up and talking to them about what, when the doctor does have a parent step out, what is normal and what is not. And at that age, you should expect talking.
She did say 9.
I did. That's actually normal at 9, all the way up to 16. Anything outside of those ranges can be abnormal.
So I'm gonna transverse these. I'm gonna. So what can you expect on your first visit? So you take your daughter, because we're older, so you don't have girls, but you're good. But for me, when what can you expect when you take your daughter to her first visit?
So, it kind of depends on what the question is about. Most of the time, you can expect us to discuss sexuality. You can expect us to discuss birth control, and you can expect possibly an abdominal exam or an abdominal ultrasound. Unless there is some sort of sexual activity, we usually don't discuss pelvic ultrasounds. There's usually some sort of first-line therapy for most OBGYN early problems, which is birth control. And birth control can be a lot more than just birth control. It can help with cycle control and pain control and other things that don't have anything to do with sex. And to get rid of some of the myths, no, it does not cause infertility. And no, it doesn't mean that your child's likely to start having sex just because you start them on some sort of birth control.
That's great information. I actually had a girlfriend who was on birth control because it regulated her cycles, just because the flow was just, either too much at times, or it was so irregular and there was just no rhyme or reason to it. And being on the birth control actually helped regulate that for her. So that's great information. Yeah. Generally, how often should you see your gynecologist?
So that's changing. It's all up in the air now.
Really? Yeah. See, I'm so glad I had you on because I didn't know any of this. Go ahead.
Yeah. This is the typical age. you want to get an exam yearly, and whether that's from a gynecologist or from a family medicine doctor or an internist, you want to make sure that you're seeing some sort of physician yearly. For most women, because they need the birth control or want the birth control and or are already in that 21 and up age group, they want to get a pap smear. But I can tell you it's very flexible. If you've had normal pap smears, for example, the recommendation now is every 3 years. And I would not be surprised if that didn't change in the future again, either back to 1 year, just as the data continues to change.
Okay. So I know for me, when and this is why I asked the question, because I'm horrible. Being a nurse, you would think that I know better, right?
Right. I know.
But that's not always the case.
A lot.
I definitely did not. So I wasn't very sexually active, but whatever. So I didn't find the need to go to my gynecologist, right? But what my primary care physician was able to do was to convince me to at least do my pap smears with her.
Yes, so you can get your pap smears with a family doctor or some internist. A lot of family doctors are kind of shying away from the pelvic exam. And, I don't care what you do as long as you get in to get that pre-cervical cancer screening. And that's a really big question that I'm going to go ahead and ask myself for you, Chrissy. What is a pap smear? What is a pap smear? Because that is the number one thing that people don't realize is that when you go to an emergency department, just because they look down there or touch down there or put something in there does not mean that you're getting a pap smear. A pap smear is a comprehensive gynecologic exam that includes a pelvic exam. So that little thing where's my hand? That opens up like that. And I don't have one. I don't have one at home. The speculum is just part of a visual pelvic exam. And now if you put in a little brush that gathers surface cells from the opening of your womb called the cervix, that is then what the pap smear is. And pap smear stands for Papa Nicolaou, I think he was a Greek gynecologist who came up with hey, we can actually discover this whole horrible thing called cervical cancer way before it ever becomes a thing with these changes at these surface level cells. And that's what the pap smear is. If you go to just getting an STD screen somewhere and they don't mention that it is a pap smear, then you probably did not get one. A lot of people, there's been too many cervical cancers that I've seen where people said, well, I just went to and got a pap smear last year at the emergency department. And no, indeed, they didn't. They were complaining of bleeding or they were complaining of something else and they got screened for STDs and never had that exam. So
does the pap smear, does it also allow you to detect HPV?
It does now. So if you're 30 and up, they can add a test called HPV testing. And a lot of, that's the difference between going to a gynecologist and a family doctor, is that your family doctor may or may not know that test is out there. And if they don't, they might not screen you for HPV. HPV adds that little bit of knowledge that may be useful. If you're not going to get it yearly, then it's definitely good to get an HPV test on top of your what we call co-testing, both the pap smear and HPV testing with it.
Are they performed the same way?
Same brush. Mm-hmm.
Same. Okay. So yeah, you would think that like just scrape me once.
Right.
Don't go in there twice.
Yeah. And they can either test it just for cytology, which is the surface cells, or they can do both, which is the little surface cells and the HPV. I know for some insurances, they're not covering the HPV testing. So you might want to check with your insurance provider to see if they're doing comprehensive. The benefit is that with these new recommendations, you can actually space out your screenings to even up to 5 years if you've had kind of a low risk sexual history, and kind of avoid that uncomfortable pap smear unless something else arises.
Okay. So we have a question. He says, I'm with my daughter before and after school throughout the week. Potty training was tough as a father, taking his daughter into public restrooms. What advice can you give me if I'm with her when she gets her first cycle?
Yeah, so the worst thing you can do is let them feel some sort of shame over it. The easiest thing to do is just to kind of like try to hide it like it's something shameful. And that's what girls feel immediately when this happens to them, is they think that they're different or that they're weird in some way, shape, or form, and how especially in front of your dad, it would be extremely embarrassing. So trying your hardest not to make a big deal out of it, but be like, hey, that's really cool, your body's changing, that's awesome, and empowering them, because now that they're women, you know be like, wow, that's awesome, you get to move on to the next step of being a woman. um, and making sure that if they're around that age, where you start noticing, okay, she's getting breast development, you're starting to see some hair under her armpits, you buy some underwear. There's actually great
Yeah,
underwear that was around when I was there.
I just saw
um,
the commercial.
I'm not saying a name or anything like that, definitely not endorsing anything, but there are some really thick underwear out there that you can just have around. That way she doesn't have to like wait in the bathroom feeling embarrassed while somebody's at the store running to get her a pad or something like that.
And I will tell you, at least, I know every girl is different, but usually that first menstruation is not as heavy, as there's going to be some light tinge. So, there may be some time to get to the store and get some items that she needs. I will tell you that when my daughter got her first, I baked her a cake. We
Yeah,
celebrated. We celebrated her into womanhood and becoming a woman and sitting down and having that conversation. But that's a mother to daughter thing. So thank you, Jeff, for asking that question. I really appreciate that, you asking that question. And maybe one day you could play this back for her and she could see how much you really did think about this for her,
right.
because that's,
And maybe because some people that have had kids at an earlier age tend to be more proactive when it comes to educating, but I still encounter many young girls who don't recognize that, hey, I started my period, this means that I'm fertile. The youngest person I've delivered, like had a baby come out of her vagina, was 12. So the worst thing you can do is not educate them in the fact that, hey, you're having periods, that means that if a boy
yes,
inserts said thing into this vagina, you can end up with a baby, even if it's just once.
yes. And even if it's 2 seconds,
Right.
time doesn't
Matter.
count. So Alan says, Alan's a little comedian. He says, is a man period a real thing? Asking for a friend. Hope you guys got a laugh out of that. Great show, ladies. As always, we'll catch the rest tomorrow. Good night. He goes to bed early because he wakes up really early for work. Good night, Alan. So that actually is a good segue into my next question, which is, can you conceive during your menstrual cycle? Can you get pregnant during your menstrual cycle?
So all menstrual cycles are unique, just like all women are unique. Some women do release an egg way earlier than other women. So traditionally, the cycle is you start cycle day 1 is the first day of your period. Cycle day 14 is when you release an egg, and there's about a 5-day fertility window around that day 14. And then you start having your period again on cycle day 28. Doesn't always work that way. I know many women who have normal ovulation, cyst before their period ends on like cycle day 7. That's when the recruitment is supposed to start from the ovaries. That's when it starts gearing up. But if women have things like PCOS or have other kinds of hormonal irregulations, diabetes, and high insulin issues, then it might not ovulate exactly as predicted. And so you can do the ovulation prediction kits, like if you're in the process of trying to have a baby, but it's not always going to be 100% accurate.
I just wanted to get to Jeff's comment real quick. He says, you answered my question. I was going to ask, should I start carrying pads just in case?
Never a bad idea, but they do have those menstrual undies that are kind of cool.
we gotta talk off air about that because I'm just like, for me, my cycle, no, like, I am not normal. But and the reason why I asked that question is because 2 of my pregnancies occurred during my menses.
Mhm.
So that's why I was like, I don't want girls to think, oh, I have my period, I can't get pregnant.
Yep. And a lot of people go to doctors and they have PCOS and they tell them, oh, because your periods aren't regular, you might be infertile. So that might sound really awful for somebody who's, trying to get pregnant. But for a young girl, it might sound awesome. Doesn't matter. I can do whatever I want and I cannot get pregnant. But that should never, if you ever hear that from a doctor, just know that, our cycles are really irregular. Even if you've tried for 5 years and can't get pregnant, that doesn't mean that, or didn't get pregnant, doesn't mean that you can't get pregnant. So you should always use a condom no matter what, every encounter, every single time.
Ben has a question. My daughters have precocious puberty.
Precocious.
Precocious puberty? What can I expect?
Man, that's a really complicated question. I think you need to see a gynecologist. That is way more complicated than just general GYN health. Precocious puberty is if you start bleeding before the age of 9, or if you start having period breast development and everything like that in that kindergarten age, so like 4, 5, 6 years old, then you should definitely see a gynecologist. There are pediatric specialists called PAG specialist, pediatric adolescent gynecologist, and also just some general endocrinologists also see pediatric patients. They can help you set up, how to protect your child's bone height and do other kinds of treatments to prevent like long-term health outcomes that can be detrimental to their development.
Amazing. Like, I'm just in awe of you right now. I really am. I'm so in awe of you. I know you were a little nervous, but by all means, that is not showing at all.
Well, my heart.
No, no,
It is.
no. I told you, when it's your thing and you know it, there's nothing to be nervous about because it's your thing and you know it. So I'm going to kind of switch it because we were just talking about this a second ago. So when trying to conceive, how long after being unsuccessful should you see your doctor?
Oh, that's a really good question because it also varies. It varies based on age. So if you're 35, which is only in namesake advanced maternal age, you should try for 6 months. And if you cannot achieve pregnancy, then you seek the care of a gynecologist, or if you can, a reproductive endocrine and fertility specialist. If you are just between the ages, I would say 18, because if you're trying real hard to get pregnant at 16, I'm going to back you up and tell you not to. But 18 to 35, the general recommendation is a year. I always tell women that if they've ever had irregular periods or really painful periods, and you've come off the birth control and you've tried really hard to get pregnant for at least 6 months, you might want to go ahead and see the gynecologist at that time instead of waiting that full year. And the gynecologist should talk to you about, test for ovulation and test for something called endometriosis. Because if you catch those earlier than the year, then you might help a woman get pregnant earlier than, having to have a lot of heartbreak in that year.
And I know this is, you like, don't ask me any questions, but I'm gonna. Well, can a tilted cervix or what is it, a prolapse? Is it called a prolapse? Is it a cervix or is it a tilted cervix? Can that also kind of prevent some, or make it a little bit harder to get pregnant or no?
No, I don't really think so. I mean, there are some extreme cases, obviously. You want to ask kind of why is it tilted, and if it's just normal. And that, I mean, that's not a technical term. I'm just kind of using the term that a lot of people use. But if you're just referring to, okay, my OBGYN has a hard time finding my cervix, versus, yeah, they told me I have a ton of fibroids, so they can never find my cervix. That's a little bit different. So it kind of depends on the why.
Okay, so we have a question here. We know who this is.
Hi.
Hello, family. Do women at the age of 70 need to see a GYN if there is not an ongoing physical condition?
Maria, I have bad news for you. Because as of 2019, they changed the recommendation where they said over 65 and a history of normal pap smears, no new changes in sexual partners, then you could stop pap smears as long as you have not had a history of high grade lesions in the past 20 years. So, yeah, that was a big long caveat. But now they're saying that you just continue PAPs indefinitely. So if you go to a gynecologist that does the HPV testing and you've had one at the age of 65, then you can have one again at the age of 70, 75, 80. Now the expectation is until you have less than 10 years to live, which we don't, how do you tell someone? Yeah.
I mean, I can't do 10 years. I can do a week, but that's about it.
Right.
In my specialty.
Don't have any of your patients coming in a while.
Can I tell you? I can't tell you. But I can tell you about some things that I've seen. But okay. So the reason that I asked this question is because I actually saw like a lot of back and forth, and I think I know the answer, but I want you to give the answer. Is exercise during pregnancy safe?
Yes, you can do the exercising that you're used to doing. There's a lot of mitos out there, especially in the Latino culture, that if you raise your hands above your head, or if you jog, or if you squat, or if you push too hard in your toilet or whatever, that you're going to cause a miscarriage. And those are all just kind of misinformative myths that linger within our culture and allow people to gain a lot of weight during pregnancy. If you're used to weightlifting, you can weightlift. The only caveat I give is that you're more prone to injury during pregnancy. So if you are, like me and prone to ligament kind of laxity, so if you're like double jointed or have just like very loose joints, pregnancy is going to make that so much worse. So you really want to either be bracing or have a spot or something like that if you're going to try to lift heavy. I also add that in your first trimester, there's a lot of things that don't have anything to do with exercise that will cause you to have a miscarriage. And 90% of the time, 80 to 90% of the time, it's going to be the way the baby's developing anyway. And so people kind of tend to blame themselves if they have a miscarriage because they exercised or whatever. And so I tell people to just know yourself when it comes to that. And if you're going to live with a lot of anxiety and guilt over having a miscarriage, and if you do, then don't exercise in early pregnancy.
Okay. Because, yeah, you definitely, it's the Latina community that I see the back and forth about you can't do that. You can't do that. And I'm like, you can absolutely do that. If it's what you were doing before the pregnancy, then yes. If you're trying to start exercising, no.
Well, you
Because
can start walking. I never ever tell people not to walk because it helps with back pain, it helps with prevent injury, but don't go trying to lift 250 pounds on a squat or trying to like push the limits of normal, going for a 10-mile run, which I don't think a lot of people would do anyway, but there's, they might have pressure from other people saying, oh, you got to stay fit during pregnancy, you got to start doing X, Y, and Z. And the answer is typically no, just do what your body's used to. Your heart's going to be racing faster. You're going to be breathing a lot harder. It's going to be you're going to be tired and sleepy all the time. So, just take it easy on your body. Know that your body's already undergoing a huge, tremendous amount of change. And that you just have to kind of listen to your body the whole time.
So is it true that actually exercising during your pregnancy makes it easier for vaginal birth?
So a lot of midwives will tell you that. I don't think that they've ever done a study to say one way or another. And I just always recommend my women to be as fit as they can be because it's not going to hurt,
And definitely there's benefits for the unborn, right? If you're living a healthy lifestyle, then that means you're providing a healthy environment for your child to grow, right?
Right. Yeah. But, again, it depends on your health state. So if you have really terrible asthma and you go exercise and it triggers your asthma, probably not the smartest thing. If you're hypertensive and your blood pressure shoots up, to the moon every time you exercise, probably not the smartest thing either. So, you just have to be really smart about it and talk to your doctor, and also, do what you can in order to take the best care of yourself.
Definitely, I was going to add that in there. Definitely speak to your obstetrician about it, because they're going to know you best. They're going to know what your lab numbers are. They're going to know what things are looking like, so they're going to be the best person to go to and have that conversation. But just as an overall, it is safe as long as you're not, doing anything new and listen to your body. Your body's going to tell you when enough is enough, right? Like when you can't do it anymore. And let me tell you, when you're pregnant, you don't want to do anything. You just want to lay there. You just want to like leave me alone. Like I don't want to, so we're gonna move on a little bit, and we're gonna start talking about just overall general women's health, and I think some things that are really important. And that first question is, when should a woman schedule her mammogram?
Okay. So mammograms, again, age dependent, and it depends on kind of other risk factors. So if you're a woman, and the recommendations also recommend on who's making the recommendation. Because if you go to the Institute of Medicine, they recommend 50 years old and then every 2 years. The American College of OBGYNs recommends 40 and every year. And the American Cancer Society might recommend something different. I believe their recommendation is 40 and yearly as well. I also think it depends on your family history. So if you have a first degree relative, and that means mother or sisters that were diagnosed before the age of 40, then you want to go 10 years before their diagnosis. So, if you, or even at the age of 40, if you're 43, then your daughters need to start at 33. And that's a general recommendation.
Okay. So I went to my primary, I'm 42. So I went to my primary, and for the last 2 years, she has been bugging me to go get my mammogram. And I'm like, ugh, nobody in my family has it. I don't need it. And that's a myth. It is a myth.
Only about 5% of cancers are hereditary. So the other 95% are de novo, which means new mutations in you. So because you're a person of color, particularly, you're more likely to get earlier cancer that's more aggressive. You really need to go get your mammogram. And I've had one. A lot of insurance companies will pay for a baseline mammogram between the ages of 35 and 40. And I tell you, like, the new technology is not that bad. The little plates don't squish your boobs as bad as people say that they do.
That's what I'm like.
Heated plates, and it's really not that bad.
Okay, because that was my thing. Like, I don't want it to squish between two plates, and then like it's gonna hurt, and like just the going and just the making the appointment and the all of this. And she said something to the effect of, look, now I'm trying to get my medical advice now. She said something to the effect of, my breast tissue is very dense, and that's why
you tend to have the perkier girls, and that tends to come with denser breast tissue, which tends to mean that it's easier to hide, lesions that look like cancer. So it's really important to go ahead and get it done.
So Emma says it's not bad. She's perkier too. She's so I'm assuming she got hers done, obviously. She says it's not that bad. So the next question, which I am really invested in, is how can you tell when menopause has started?
Also not an easy. God, I just don't like easy questions.
Sorry.
Yeah, also very complicated. So menopause is defined by 12 months, no period. And that is in a woman that's kind of in the right age group between the ages of 40 and 51. The average age is about 51. So some people might not go until almost 60, although that's definitely in the outlier type category. If you're between those ages and you're kind of getting lighter and lighter and more spaced out, that can be normal. If you started having hot flashes, mood swings, other vaginal dryness and things like that, it's always a good idea to speak to your gynecologist if there's ever any doubt, particularly as you get above the age of 40. if your periods are very heavy or all of a sudden it feels like something is changing, please go talk to a healthcare provider so that they can diagnose the problem early.
So is there a such thing as, because I'm throwing things out there. I said I wouldn't, but I lied.
Mm,
Is there a such thing as perimenopause?
there is, and it's, again, not a diagnosis that we can make with labs. So I get people between the ages of 35 to 45 commonly asking to come in and get their hormones checked. And the problem with getting your hormones checked is that it's not an easy yes or no. It's not like checky box here. Um, your hormones can change from cell to cell. So your ovary can read one hormone and then change it into something else, and make the estrogen that your blood levels may be off on. Our bodies are just that good. Like we are created perfectly. And you're going to be able to, not necessarily go based on a blood level or a saliva level or whatever else uh, somebody might be selling you yet, because it's such a transition phase. It's a time when we're kind of vulnerable to suggestion because we don't understand what's going on or how it is. A lot of people take advantage and try to sell you blood levels and saliva levels and all these things, knowing that it's really hard to interpret. So then they say, oh, you got to repeat it. Oh, and then you got to go do this and you got to go do that. So
And is this something that insurance is usually paying for?
Not typically. So if you
Okay.
have irregular periods already at baseline and you're kind of trying to figure out, is this something that's abnormal or is this something that's, normal, they might cover it, but I wouldn't say all of the time because there's so many different plans and so many different coverage tiers and whatnot. Just you will have to talk to your insurance provider before that visit to kind of find out, is that something that yes or no they're gonna cover or not.
So I want to just throw this. Go ahead. Finish.
Back to the perimenopause. There is perimenopause. For some people, it can start as early as like 10 years prior to actually having those 12 months of no no period, or the menopause, and it can be mitigated or minimized if you go talk to your gynecologist.
Okay. I want to just throw out this little caveat for people who are watching, just because we're both from the healthcare profession. You are the designator of your healthcare, right? You are control of that. So if a doctor recommends something, you should absolutely take that into consideration. And you can speak to your insurance company prior to any testing or anything to find out if it's going to be covered. And then also speak with another doctor to find out if it's something that's necessary. And the reason why I say this is because with me as a hospice nurse, I'll get someone who's coming on for cancer, and they'll say they're coming on to hospice now, right? Which means that we're not going to have any vigorous treatment, any extraordinary measures. We're going to kind of let the thing, and the doctor is still pushing for them to do some type of testing for the cancer. And it's like, but you're coming onto hospice. If you do this and you get your results, are you going to do anything with it?
Right.
So
everybody has to make that decision for themselves. Usually it's hard because Google is very tempting, and it is very much a place and a day and age where we can literally look everything up and feel that we know more than we do, and a little bit of knowledge can be very dangerous. So it's always really important to be proactive, not just in learning what you can, but also in verifying the truth, and not just being fooled by somebody's opinion, because and that can be a professional opinion as well. Now I feel there's an overwhelming amount of healthcare professionals who feel that they can give you a sense of security because they're wearing a white coat and they may have 2 years of an education. Because they speak confidently does not mean that they know what they're talking about. So always know what level of education somebody has obtained and what level of experience they have, and always look for, I wouldn't say necessarily Google reviews, but possibly other patients that have had that same physician or physician assistant or nurse practitioner or whatnot to make sure that you're getting knowledgeable information and have people with, similar experiences who've had a good outcome.
Absolutely. It's so important. You, like I said before, you own your health care. You own
Right.
your health. So you're in control of that. And I think a lot of dealing with the older generation being in hospice, I find that they're like, but the doctor said, and there
Right.
isn't a lot of self-thought in it.
Right.
And it's just generational. I think as the generations keep going, we're growing with that and understanding that it is healthcare is consumer based.
Right.
It really is. So we got the just go to the doctor. Your health is more important than money in and a short period of pain. So we have a question. Um, can menopause last for the rest of my days? Well, seriously, 8 years, and I still go through those hot and cold flashes. Nevertheless, mood swings.
So yes, it can. It can definitely last. You learn to kind of minimize symptoms here and there. There's a really great website for anything menopause. It's from the North American Menopause Society, NAMS for short, and it's menopause.org. It's a super great resource. On their website, there's a whole link of like natural therapies for menopause. And if you're under the age of 60, there's, a lot of hormones that can help minimize those symptoms. But it is super important to kind of know what your risks are for other things and to have that discussion with your gynecologist or healthcare professional to kind of know what's right for you.
Awesome. So I want to get into this last subject, and we kind of touched on it a little bit here and there. But basically, cancer, overall women's reproductive cancer, so breast, ovarian, uterine. What are some things to look for? Like, what are some things like, if you're like me, like I'm not gonna do a mammogram, right? But you should. You should. I'm here to tell you, go do it. Don't listen. Don't listen to me. Don't.
Right here, right now. Okay. By the time you have symptoms, you're usually in stage 3 to 4 cancer. That's too late. That's when you're looking at, how long can I live? Not can I cure it? So when it comes to ovarian cancer, there is no screening. So if you're looking for like bloating and you're looking for weight loss, you're pretty much guaranteed to have a stage 3 to 4 cancer. But if your gynecologist at some point in time tells you, hey, you just had an ultrasound and you had this abnormality and we need to look at it again, just do it. Because if you can catch something early, then you can prevent yourself from having to, undergo chemo or radiation and other kinds of things that can really affect the quality of your life. When it comes to mammograms, the best prevention is early detection, right? So
Yeah.
you have to go to get your mammogram every single year. It does not hurt as bad as having a lumpectomy, chemo, and radiation. So particularly in women of color, you have to go and get your mammograms.
I think I'm gonna have to go get it done, and I'm gonna have to document it and then post it. Not the actual mammogram people, right? So not that, but just the documentation of making the appointment, going to the appointment, kind of
I will
before
say,
and
though, that image of my breast, I'm like, oh, those look good. I like those.
after.
I can post those. I don't mind.
Okay. Oh, so I'll post those too then.
No.
So you said there's no detection for ovarian? Like there's no testing for ovarian?
There is no screening. So in
Okay.
order for something to be a screening test, you have to be able to catch it in kind of like that pre-cancer phase. And the only thing we know right now that can lower your risk of ovarian cancer is number one, doing birth control. If you do that for about 10 years, then you can reduce your chances of having ovarian cancer. And number two, having your tubes removed, something called a salpingectomy. So, some women who want to get their tubes tied, if they actually go ahead and remove the whole tube, we now know that what we thought was ovarian cancer may initiate in the tubes, and you can actually reduce your risk of ovarian cancer by doing that.
I missed that by 14 years. They were tied 14 years ago.
Okay.
I don't know that we knew that 14 years ago. Did we know that 14 years ago? No.
And then uterine cancer, that one usually does have early symptoms. So that's what we talked about, perimenopause and that irregular cycle. If you have heavy bleeding or if you start having, just some sort of bleeding between your periods, always go have that checked out. And if you have bleeding after menopause at all, I don't care if it's a spot or even just, oh, I only wiped twice and then I saw something, go ahead and have it evaluated. Because if you have bleeding after menopause, after those 12 months, no period, you have about a 19% chance of having a cancer diagnosed. So it's always good to go ahead and get in there early. And then when it comes to cervical cancer, obviously get your pap smears. And I don't care what frequency they change it to, I still am an advocate for yearly pap smears.
And when they change the standards, does and I know this is more of an insurance question. When they change the standards, do insurances usually tend to flip with whatever the standards are? So something may be out of pocket,
They're slowly doing that. But my biggest concern with the way that it's happening is that, with the electronic medical record, it'll flag people like, oh, your pap smear is not due for 3 years. Well, if you just had an abnormal and your actual follow-up is 6 months or a year, the electronic medical record does not have a brain. All it does is a pattern recognition. It doesn't tell you what your doctor really indicates for you. So if there's ever any question beyond a year, ask your doctor.
Awesome. So we're almost at that hour mark, and I definitely learned today, as I knew I would, because you're a brilliant, intelligent woman, and my brother is so lucky. I said that. You're lucky. But I usually...
He makes what I do possible. That's 100% a fact.
Well, there you go. Teamwork makes the dream work, right?
Right.
Not all the time, though. But if you were able to tell somebody the most important thing, like the one thing that you want them to get out of this show, with all the information provided, what would be the one thing that you would say to a woman to get her to the doctors or something like that?
I would say the number one most important thing is to not be afraid of going to the doctor. Fear has no use for prevention. So, the fear that you have isn't going to be more powerful or any more painful than an actual disease. And then question everything. I love it when people come in with questions, because that tells me that you've done some reading and that you're actually getting what I'm saying. So always write them down, because as soon as you hit the floor with a physician or with somebody that's wearing a white coat, everything goes out of your brain. So make sure you write those questions down and ask those things, because my annual will consist of, let's talk about diet, let's talk about exercise, and nobody wants to hear about that half the time. Half the time they have 10 different questions, and it'll either be hey, that'll be addressed at some other time, but it's really important, so let's give it its due time, or it'll be related to what we already need to talk about, and it'll help me clarify like what actually needs to be presented in a way that is heard. Because a lot of it sounds like a stream of words that come out unless I know that you actually have a curiosity or a question about that. So it's really important to know that you're interested in writing them down.
So I definitely say write it down, because even as a nurse, when I went to my primary care physician, I forgot to tell her that I have a fluid pocket filled on my neck that moves. So when I go back next year, I'll let her know there's a pocket fluid filled that moves on my neck. I have no idea what it is, really, but definitely write your questions down. Take them in. I hope you guys were able to get some information out of the show. Before I say goodbye, I always go back and make sure that if you liked any of the content that you saw on the show tonight, make sure you go to Instagram and Facebook and like and follow at Chrissy.Cipher. You'll be able to watch this episode again. Also, make sure you head over to 2M1L Media on YouTube. You'll get get all the different shows that we have on our media channel, which is around the turnbuckle, Saturdays and Sundays, 6 p.m. Eastern Standard Time. You'll get to see Fitting with Spitter, 8 p.m. on Wednesdays. You'll have Home Team Sports and Entertainment Tuesdays at 6 p.m. And then Ciphered Knowledge every Sunday, 8 p.m. Eastern Standard Time. Before or when you get next week. We're not talking about my pap on the air. But I'm going to leave you with my slogan that I say at the end of every show, which is, if all you've experienced is all you know, then you are in a deficit of knowledge. So hopefully we were able to provide you a bunch of information and knowledge throughout the show. I want to thank you so much for joining the Cipher. I also want to thank Dr. Aguirre again for being on the show and providing this wealth of information. I know that you've reached someone out there. I'm glad to see the men were watching and asking questions about their daughter. I love it. So just keep asking the questions and we'll keep providing the content and information. So on that note, one love, everybody.
Thanks.